My name is Dr. Lee. I'm a gastroenterologist and I trained at Meharry Medical College. I completed my residency at Michigan State University and my gastroenterology fellowship at the University of Kansas Medical Center and Wayne State University in Michigan. I've been a physician for over 40 years and have performed more than 30,000 gastrointestinal procedures, including colonoscopy and upper endoscopy. Before you trust anyone with your health, you should know who's speaking to you. My name is Dr. Lee. Most doctors are known by their last name. It's formal, professional, distant in a way. But over the years, my patients simply started calling me Dr. Lee. And somewhere along the line, it became more than just a name. It became part of who I am. That's why I chose the name Dr. Lee MD for this channel. Not as a brand, but as a continuation of the relationship I've always tried to have with my patients. I've always believed that the best doctors don't lead with ego, they lead with compassion, honesty, and a genuine desire to help people heal. Because I believe great medicine starts with compassion, patients deserve more than rushed appointments and confusing explanations. They deserve honesty, clarity, and a doctor who genuinely cares what happens to them. For more than 40 years, I've been a physician in some of the country's most respected hospitals. I've performed over 30,000 gastrointestinal procedures. I've diagnosed cancers early enough to save lives, and I've seen what happens when cancer is discovered too late. Those experiences stay with you. They change the way you see medicine. They change the way you see people. As a cancer survivor, and this became even more personal to me because I'm also a cancer survivor myself. So when I speak to you on this channel, I'm not speaking only as a physician. I'm speaking as someone who understands fear, uncertainty, and the importance of catching disease before it is too late. I didn't come from privilege. I grew up poor in the South, United States. My father was a truck driver, my mother was a laborer. Both my parents had only a middle school education. By every statistic, I was never supposed to be a doctor. But through faith, hard work, and people who believed in me, somehow I made it here. I want to tell you about a patient I'll never forget. He was 57 years old, no symptoms, no pain, no blood he could see, but he had a family history of cancer. And that's what's brought him in for a screening visit. The routine blood work showed a low hemoglobin and anemia. He hadn't felt there was anything wrong, but that number meant something. We ran a stool test for hemoccult, and it came back positive for blood. He hadn't noticed anything wrong. He felt fine, but that number told me something. We ran a stool test, hemoccult. 1 of 3 samples came back positive for blood. Blood he couldn't see, couldn't feel, had no idea was there. To find the source, we did both an upper and a lower endoscopy. We found a small mass in the colon and a second small mass in the small intestines. Both were removed. Both biopsies came back positive for cancer. Now we found 2 primary cancers, no symptoms, caught entirely because of 1 routine blood count. Today, he is completely cancer-free. Total cure, both cancers. This is what early detection looks like, and that is exactly why this channel exists. What is my mission? After decades in medicine, I realized something that changed my life forever. Most people are not getting sick because they're lazy. Most people are definitely not trying to ignore their health. The problem is that many people never learn the warning signs early enough. Nobody explained the silent symptoms. Nobody explained the hidden medication dangers. Nobody explained what certain foods, habits, and everyday mistakes were quietly doing to their kidneys, heart, gut, blood vessels, and overall health. That's why I created this channel. Not for clicks, not for fear, and not to replace your doctor. I created this channel because there are things that your doctor may simply not have time to explain during a short office visit. The silent warning signs people often overlook. The symptoms that seem harmless but aren't. The foods and medications quietly damaging the body over time. And the small changes that can sometimes prevent devastating disease later. Let me be clear. Let me be clear about a few things. This channel is educational. Every video reflects my clinical knowledge and 40 years of practice and experience. I use AI tools to help me produce content consistently, captions, editing, and research summaries. But every medical claim on this channel is reviewed and approved by me personally. If I wouldn't say it to a patient in my office, it does not go on this channel. This channel is not a replacement for your doctor. I cannot examine you. I cannot order your labs. I cannot read your scans. If something in one of my videos concerns you, please call your physician. That's not a disclaimer, that's a prescription. If I tell you something is good for your liver, it's because the evidence says so. And this channel will tell you the truth, even when it's uncomfortable. My goal is simple, to get you off the couch and into your doctor's office before it's too late. That's the deal. I've also written countless patient education books and guides to help people better understand their health. And my upcoming book on prostate cancer will be released in the coming months. Now you might ask, why trust Dr. Lee? Why trust me? But none of my titles, credentials, or accomplishments are the real reason you should trust me. The reason you should trust me is because everything I teach here comes from a lifetime spent sitting face to face with real patients, real families, and real consequences. My mission is simple: to help you recognize the signs most people miss before it becomes irreversible. So if you care about protecting your health, understanding your body, and learning what most people never hear until it's too late, subscribe to Dr. Lee, MD. Because early knowledge changes outcomes. I'm Dr. Lee, and I'll see you in the next video.